When we created Eos Wellness Surgery Center, we imagined a multidisciplinary surgical center filled with 5-star doctors. What that means is that each doctor has been vetted by our governing body to deliver an outstanding experience as well as excellent results for our patients. We have specialists in gastroenterology, podiatry, OBGYN, ear, nose, and throat, among others. I founded the surgery center because I felt that in my surgical practice, I provided that missing experience that is not there in the healthcare field. I feel like the normal healthcare experience for most patients is pretty dismal. Our aim is to elevate the healthcare experience to the 21st century. That means more high-tech communications, including texting, which not a lot of doctors' offices do, keeping you fully informed of the process and what to expect when you come to the surgical center. In addition, we find ways to minimize any kind of discomfort and create the most positive experience possible. The physicians that come to our surgical center are the same ones that I would use or my staff. Also, how do you find a doctor? Most people go through the recommendation of their physician or sometimes their friends, but we do all that work for you. We have gone through the credentials of each board-certified physician and coupled it with a lot of online reviews to make sure that you get not only a well-qualified doctor, but someone who could provide that excellent customer service. At Eos Wellness Surgical Center, we want to make these procedures as easy as possible for you. We want to eliminate the headache of making sure that you have the right doctor, and we want to minimize any kind of issues that can happen before or after the procedure. What I'm especially proud of is our safety profile at Eos Wellness Surgery Center. We go through a very rigorous certification process called the Joint Commission or Medicare. This is the same certification that hospitals undergo, and it's very unique to ambulatory surgical centers. Most surgical centers don't go through this rigorous process because it's the most difficult certification to get. In the end, what it means for you, though, is the highest level of safety. We also only use board-certified anesthesiologists. Now, these are medical doctors and not nurse anesthetists or other assistants. We make sure that they're vetted and their board certifications are up to date. Finally, all of our staff have plenty of experience, including our nurses. Our nurses not only have experience in outpatient surgical centers, but also in hospitals and ICUs. It's very important at an outpatient surgical center to have these very experienced providers that, again, will help ensure your safety. If you find yourself in need of a surgical procedure, keep us in mind as we can connect you with the right physician.